Hey, what's up, everyone? It's Dr. Glenn Vo. I am super excited to have Dr. Jeremy Krell from Revere Partners. Jeremy, it's been a while. I've been trying to get you on this podcast. We finally got you on. Super excited to have you here. And let's just dive right into it, okay? Let's just dive right in. So first of all, Revere Partners. What is Revere Partners? What do you guys do? How do you guys support all these up-and-coming dental companies? Tell us about that.
Great question. First of all, an honor to be here. Glenn, thanks so much for having me on the podcast. Revere Partners is the first and only independent venture capital fund for oral health technology startups. And we support any private dental startup, any product, service, innovation in the dental space that is looking for funding.
Okay. Now, obviously, you're practicing. Are you still practicing? Are you doing this full time? Tell us about where your career is at when it comes to clinical dentistry.
Yeah, great question. So I am not practicing anymore. I stopped practicing actually right before the pandemic, and I do Revere Partners full time. I'm the managing partner. So, it's a lot of work from the investment side and working with our investors to the startup side and understanding deal flow and diligence all the way through to now our new corporate services side. So very much a full-time job on the business side of dentistry.
Well, and I asked you that because, again, Revere Partners, this is not like a side gig that you just kind of dabble on the weekends. This is actually a full-time business, something that you're put a lot of bandwidth in. And so I want to ask you, what got you interested? Why did you start Revere Partners? Where was the motivation there? Tell us about how the company was formed and how you got to this certain point.
Yeah, sure. So maybe a little bit about the journey. So I am a general dentist by clinical training, been so for the better part of the last decade. But as I mentioned, I don't practice anymore. Really, the startup itch came first. So I've been in startups for about 18 years. I started in tech first, then health tech startups, and then I transitioned to oral tech startups. So some of those startups include, for example, Oscar Health Insurance in the health tech space, and then in the dental space, for example, Quip. And then finally, after Quip, really having been approached by lots of entrepreneurs who wanted me to advise or invest or sit on boards, I remembered that my passion was really to grow and start new innovative things. So I started my own, I guess you could call it, boutique consulting firm meets family office called the Barchester Bay Group, which is really the precursor to Revere. As I was listening to our clients at the Barchester Bay Group, what they needed was an institutional investor to really centralize and organize the investment space in oral health technologies. And so we started Revere Partners as the first venture capital fund.
So I want you to give a very just simple explanation of how private equity works, how it helps companies. Sure. Because again, a lot of times, a lot of our listeners and viewers, they're wondering, okay, private equity, they're always thinking oh, is it like purchasing practices and whatnot? But again, what you do is you actually help these companies get to the next level. So just kind of explain the process, from someone coming and reaching out to you and saying, I would love your help in this project, and then you seeing the value and wanting to get part. So kind of just go through that journey in a kind of a simple way so that our listeners and viewers can understand.
Yeah, absolutely. Sure. So, and maybe the first clarification to make is, generally in dentistry, private equity, are the investors that are typically investing in operational businesses, service businesses. And what I mean by that is dental practices. Whereas Revere Partners is really investing in dental technology companies. Okay. So product or service technology companies. So these are companies that you commonly hear these terms thrown around, a seed stage company or a Series A stage company. Right? These are early stage technology companies that are in the process of forming their products or services, validating their products or services, and then growing and scaling their products and services. And they need money to do that. They need to support marketing. They need to hire software developers or product developers. They need sales, right? And so the capital that we're investing, the venture capital, is really growth capital for these product and service technology companies in dentistry.
And so where do you guys get the funding? So when we're talking about getting funding, where is that coming from? Is it coming from individuals, coming from other companies, coming from other investment groups? Where does that funding come from?
Yeah, great question, Glenn. So it's really coming from all of you, right? It's coming from all of us. Revere Partners was very much started by doctors for doctors. Certainly our investor set has expanded, well beyond that, but it still very much is culturally by doctors and for doctors. Our investors all have to be accredited investors, and they range, which most dentists meet the criteria of, and range really from angel investors, so a doctor, a dentist, a professional, all the way through to high net worth individuals, family offices, corporates, as well as funds. So we have all of these types of investors, from single individuals all the way to large organizations investing into Revere, and that money going into dental technology innovation.
Now, I'm going to ask a follow-up question here because I'm curious myself. So if someone wants to actually get into this fund, right? How does that process work? Yeah, how's that process work? Is there a vetting process there on your part? Tell us about that.
Yeah, absolutely. So, normally a traditional venture capital fund, they raise money and then they close the fund. You can no longer get in. Revere actually has an innovative model behind its fund, and we remain open. And that was very important to us from day one, because we knew that as a new vertical, a new area within dentistry, we wanted new people to learn about it and be able to take part in it. So we can start people on a quarterly basis, and they're essentially subscribed out at least 4 quarters. So it's like any other subscription in your life, like Netflix, for example.
Yeah.
Right? So anybody can start. They simply have to reach out to our team. Yes, we like to meet all of our investors and know the great people that we're working with. And yes, you do have to meet the accredited investor standards, which are not a high bar for this industry generally. And then from there, it's a very simple process. We give you a link, you fill out your profile, you can complete everything in there.
Now, obviously, Revere, supports and invests in different companies. By coming on as an investor with Revere, do you get to pick and choose which projects you want to do? Or is it just like a general fund that, like, we're going to do this and it's all coming in there? Like, is there any kind of choices there?
Yeah, another great question. So I'm going to present it sort of as a hybrid model, right? So as a venture capital fund, myself and our other general partner and CFO, Dave, he and I have the discretion to make investments. We make 3 to 5 investments per quarter. So we are investing our investors' capital into the best and the brightest of the dental technology startups and their founders. However, there are often cases where there's excess allocation, more room in the rounds of money that these startups are raising, because it takes a lot of money for these startups to grow and be successful. And in those cases, we offer all of our investors the ability to add more into any investment that they really like. And they're doing that underneath our same terms as a venture capital fund, right? Which is a worthwhile point, because as an individual investing into a startup, you typically do not get a wide variety of different proprietary terms. You don't get these valuation discounts, you don't get these interest levels, you don't get these, pro rata rights necessarily. And we have all of these types of additional rights included, making the investment terms much, much sweeter.
Now, I'm going to go to the other side now. So let's say that there's someone who is watching, listening right now. They have an amazing platform and they actually need that support to scale. How do these particular companies, these particular startup get in contact? Like, how does that process work? Do they just reach out to you, and then does Revere do an evaluation, or actually do they actually have to have something or an evaluation done already before they even meet you guys? How does that work?
Yeah, it's a great question. So our team is about 75 people. We have a big database technology stack and a diligence process. So essentially, when we meet a new startup, they go through a screening process. Are they humans that breathe air? And we have to ask that question with the internet these days. Do they have a private dental company, right, doing something good for the dental industry, or interesting, innovative, or inventive? And so they'll go through a very brief screening process. They'll meet one of our team members for 20 minutes or 30 minutes or so. Then they'll go into what we call primary diligence. They'll do a pitch. Right? They'll come with their pitch deck. They'll pitch it to a team.
Kind of like a Shark Tank.
Kind of like a Shark Tank. There's 5, typically around 5 people there. One of our general partners, like myself, a venture partner, and then a couple of our associates.
Where does that actually take place? Does that take place at the home office? Does that take place
we
just somewhere central, or how does that work?
These days we do it virtually.
Okay.
To help the pandemic, and because Revere is actually global. While the majority of investors and investments are from and in the United States, we actually have several, globally as well. So for those reasons, we typically do these virtually, although we're based in New York City. And from that point forward, then the venture partner determines what secondary diligence, deeper amounts of information are needed. So we basically walk them through what is in total a 26-point diligence process.
Wow.
It only can go as quickly as just a few weeks, but we make sure that we check out, of course, every business we're investing in.
So let's just, again, for those who are interested and they want to reach out, what are some of the things that you would expect from them to make the process easier? Like record of sales, like what are some of the things that they should submit that, hey, this can make this process easier for us?
Yeah, certainly the more organized they are, the quicker and smoother this process will go. So, inclusive of having a pitch deck ready, inclusive of, making sure that, they have their latest financial statements ready. Some startups organize them into what we call a data room, where they put all of their company's organizing documents, all of their financial documents, all of their sales and marketing plans into one digital space, like a Google Drive or, hosted on any other platform. So the more organized they are from the start, the better.
The faster the process,
the faster the process, and, our team can review things more easily and seamlessly in one place. When we send forms to fill out, if those are returned quickly and thoroughly, that really helps. So these are the types of things that make the process go a little bit quicker.
So I'm going to ask you kind of like a funny question here.
Sure.
And we don't have to mention any names.
Sure.
What is the most ridiculous pitch you've ever gotten?
Oh, that's a tough one.
There's got to be something that sticks out.
There are.
And we don't necessarily have to talk about actually the product, but let's talk about maybe they sent like 1-page PDF or something like that.
Yeah.
And again, we're the whole goal here is not to shame anyone. The whole goal is to make sure you don't do this. Okay.
Yeah. So we did have one entrepreneur I recall who came into the pitch. We always ask for the pitch deck in advance. It's part of our review process, and they assured us that they'd have it ready. So we made a kind of one-time exemption, which we don't really do, and probably for this purpose. They filled out our questionnaire and everything, got on the call, and then the pitch deck, the pitch process was this person going through the slides, typing out the information on each slide as they were presenting it to us, right?
Wow.
Which is, I think they were going for some sort of creative angle there, but that definitely didn't work out.
Well, maybe they're just trying to multitask right there, right? Have a meeting with you and just pitch it at the same time there. Now, I don't know how much you can reveal here, but the companies that Revere's invested with, what are the ones that you're really excited about that you can share with us?
Yeah, there's a few really exciting areas for sure. We've made 22 investments. One company's been acquired. 3 are in acquisition conversations at least now. So lots and lots of traction, that goes on. Some of the areas are really exciting. So one area is this total area of RCM, revenue cycle management, right?
That's a big topic, and that's
huge
something huge
mess
in every single practice.
That's right. It's a big, big mess across dentistry. We see it kind of breaking down into 5 different buckets. For example, one of those is credentialing, one of those is payments, one of those is financing, one of those is insurance verification, and then the last one's claims processing.
Those are all really big.
These are all 5 big, sub buckets of RCM. And so there's a couple of startups popping up in each of those categories that we've seen, really, really be promising in offering patients something new, right? Offering an option for financing where, based on their FICO score, maybe they wouldn't have had anything reasonable before. So that is definitely an area of interest. Another one is this area of microbiome, understanding who are the bad actor bacteria in your mouth, in what concentration are they or quantification are they, and then how do we, from a therapeutic standpoint, how do we customize a solution to your mouth, right? Rather than some sort of one-size-fits-all solution for everybody. So there's another really exciting kind of space.
So these companies that you just brought up, obviously we want to keep everything kind of confidential, but how far are they from doing like a really expansive launch to really get out there?
Yeah, almost all of these are already on the market in some capacity. I mean, we will look at pre-seed and seed stage startups. We probably invest most in seed to Series A stage startups. So things that are on the market in some capacity, although we definitely see them, earlier than that. And they are starting to make their mark already. They typically start with, you hear these terms thrown around, an alpha or a beta launch, right? They're starting with a purposely small group of users, testers, customers, because they want to make sure to fine tune the experience and the process and the product to make sure that it's, game time ready for large audiences.
Yeah. So, again, for those who want to reach out, whether you have a platform that you want Jeremy and his team to kind of evaluate and possibly fund, or if you actually want to be an investor in the fund, what's the best way to get in touch?
Yeah, you can always reach me directly. That's Jeremy@ReverePartnersVC.com. You can also reach out to the rest of our team for any general questions or process-oriented questions at info@ReverePartnersVC.com.
And if you're at a lot of dental events, DEO events, dental festival events, Jeremy's normally there. Just reach out to him, pretty approachable. Or you can just stalk him on LinkedIn like I do. So again,
always very active on LinkedIn, and I'm a road warrior at many of the main dental conferences. So happy always to meet new people.
Jeremy, thank you so much for jumping on. Guys, thanks for tuning in. And we'll have everything in the show notes so that you can reach out to Jeremy and at Revere. Thank you so much, Jeremy.
Thank you so much.